Thank you, Chris, and thank you, Mayor Lane, and your terrific team at the city. The city of Scottsdale has been just really a wonderful and critical partner for HonorHealth and a key to our success over the more than 50 years together now in developing and growing together as HonorHealth has grown and as the city of Scottsdale has grown. And we're really grateful to have this as our home and our ability to serve this community. Today I'm going to focus on the work that we've done together over the past decade or so in our HonorHealth Research Institute and some of the advances that have come. The one thing I can promise you is that this is going to be very rapid in trying to cover that terrain in this amount of time. Just first as a reminder, of HonorHealth is the merger of Scottsdale Healthcare and John C. Lincoln came together in 2015 to serve our community of about 1.6 million people across Scottsdale and the greater Phoenix area. We bring together more than 11,000 employees and 3,000 physicians, so a major employer in this area. And our campuses involve three major campuses in Scottsdale along the east, as well as three across Phoenix, and more than 74 ambulatory campuses spread across the greater Phoenix area. We began our story more than 50 years ago in the South Scottsdale and the Old Town area with the Osborne Medical Center up in the upper left corner. You see that building in the 60s just coming into focus. On the right is what the hospital looks like today. You see there the home of our hybrid OR and our joint Department of Defense military partnership involving training, clinical care, and research there, particularly in trauma and other areas. About 20 years later, in the 80s, developing on the Shea campus, about 11 miles north. You see the campus taking shape there, and today, a home of many elective surgeries, our women's and family services and such. It's also the home of Virginia G. Piper Cancer Center, our first multidisciplinary cancer center on one roof in the area that brings together our campus of our cancer center as well as our HonorHealth Research Institute. At the bottom left, you see our Chief Scientific Officer, Dr. Dan Von Hoff, a true local and national treasure, probably developed more new cancer therapies than anybody in the world and knows as much about pancreas cancer and the care of anybody. And then in the early 2000s, again about 11 miles to the north at Thompson Peak, the new Thompson Peak Medical Center. You see there the robotic surgery and a complete care now developed in our North Scottsdale area. But I'm going to focus on a work that started in 2005 and was initiated by a lead gift of the Virginia G. Piper Charitable Trust. It all began with that philanthropy and the strategic development which brought together Scottsdale Healthcare at that time with Dr. Von Hoff as our Chief Scientific Officer, a strategic partnership with TGen as a scientific partner, and to develop a focus on the potential of what was developing in personalized medicine and in cancer and beyond. One of the unique aspects of our research institute is that we are very focused on a singular purpose, and that is we exist for nothing else than to bring tomorrow's cures to our community today and to accelerate that pathway of those new interventions that can benefit patients right here, right now in our community. If we go back and think about what the world was like at that time, this is a New England Journal article that took a look at the results of cancer therapies and their development up through 2002. Drug development at that time was really a trial and error, throw things on the wall and see what sticks kind of an approach, and only 4% of patients in phase 1 clinical trials for cancer had any kind of clinical benefit. We knew that we had to do different, we knew we could do better, and we knew that by bringing the best science and combining that with the best care, we could make a difference and improve that dramatically. So our approach is right in line with what Mayor Lane talked about and the Cure Corridor concept. Knock down the walls, create an institute without walls that brings in collaboration. The best talent, the best technologies from across our area, as well as across the country and across the world into Scottsdale to make a difference for our community. You see some of our collaborators on this board here, which include hospitals, universities, research institutions, and companies to get that technology and talent together. The concept then is leveraging that talent to make a real difference. And here's an example of a basic science team with Dr. Von Hoff, his team at TGen, doing the basic science and the work on developing biomarkers and understanding of disease mechanisms, seamlessly handing off to a TD2, our Scottsdale partners, doing the preclinical work, and then to our clinical teams that are doing the clinical research at being able to develop these drugs, test them in humans, and move it forward. That initial work was supported by Jerry Bisgrove and the Stardust Foundation right here in Scottsdale with the Bisgrove study that pulled together a 9-site national study to test this concept of personalized medicine and show we could go from theory to practice, identifying targets for treatment in cancer, that there were novel drug combinations to make an effect, and that you would improve clinical outcomes. That work spurred the great development where now targeted therapies are commonplace around the country. That gave us confidence to move into clinical trials, and this was one of our first that involved the very first person in the world to try this new therapy was a local Scottsdale man in his 70s that had metastatic basal cell cancer. His cancer had gone to his lungs, to his liver, to his bones. He was on oxygen. He was in terrible pain, sent to hospice with about a 6-week life expectancy. But through the research that had been done demonstrating new molecular pathways and understanding, in this case it was the hedgehog pathway that was implicated in these basal cell cancers, we could apply an oral agent, a pill, rather than a traditional chemotherapy. And you see on the right-hand side there his scans at 8 months with the cancer dramatically reducing in his lungs. This is Jerry at a neurological exam, Dr. Von Hoff, in the middle of treatment here, off of the oxygen, back home to normal living with exercising, dancing, and a terrific clinical outcome. What else should be noticed is that the drug company that was developing this drug was ready to throw the drug away because it had failed that trial and error kind of a general cancer trial. And it was through this targeted therapy that we were able to identify which patients would benefit from this. And the drug then subsequently was approved by the FDA through a fast-track mechanism that took what typically takes more than 15 years and $1 billion to develop a new cancer drug, did that in less than 5 years. There's the package insert from the drug Vismodegib. There's Jerry's wife and a couple of the research nurses showing that this approach to combining molecular medicine with drug development in an accelerated process can speed interventions. This is now common practice out there, not only for basal cell cancers, but available for certain brain tumors in children and other cancers as well. But this is what we really hope for, and this is the result. This is an 87-year-old with the cancers into his ear and skull. Complete response, cancer-free. He decides to celebrate by skydiving. This is what it's all about, bringing new life to our patients. Those results then encourage others. So Stand Up to Cancer, the Hollywood effort that says that the government is moving too slow on cancer, wanted to put together the 5 dream teams that had the best chance of collaborative work to be able to make breakthrough advances in cancer. We were identified as the group for pancreas cancer with our partners at TGen, Johns Hopkins, University of Pennsylvania, and Columbia, and the Salk Institute. So a high-powered group coming together. HonorHealth was the only community site and non-academic that was a part of the Dream Team's effort. We're very proud to say that now we've received 3 of these Dream Team awards and been part of that, the only group that's had repeat awards and continues to lead the efforts in pancreas cancer. So what difference does that make to our community? Well, this is an example of a man who's benefited from that, and bringing that talent and that technology from these key partners around the country together here has led to breakthroughs for pancreas cancer. 3 new approaches that are through the FDA that have doubled the 1 and 2 year survival. This is a gentleman who came to us with stage 4 pancreas cancer. He's now back to work for the city of Phoenix. He's had a complete response and at this point has no detectable cancer. And he's giving a talk there to Celgene, one of our local partners who developed one of the drugs in his combination therapy. So the work that's being done there has given us new hope for even such difficult diseases as pancreas cancer, where we have some patients with stage 4 pancreas cancer living with us more than a decade and giving us hope for the future in eradicating that difficult disease. The work is not just in cancer. Some major advances in cardiovascular and other diseases here. We've done the seminal work in development of new stents, both drug-eluting stents and bioabsorbable stents, so stents that actually dissolve and leave the heart vessel repaired. First humans in the world to get those were right here. The work that was done here a decade before, these have gone through FDA for approval. Also work on minimally invasive heart valve replacement, making a huge difference in cardiovascular care for our community. That leads to not only better care for our community, but Scottsdale being a true destination site for medical innovation. Patients from 49 states, who has a friend in Rhode Island? Please send them our way. 49 states and 24 countries have come here to Scottsdale. My favorite story there is a gentleman from Palo Alto who bypassed a pretty fair medical school to come here. He had a rare cancer, first in human study, 92 times over a 6-year period. He came here to Scottsdale for his care and for services in our community, went away cancer-free. So it's really been remarkable, not only bringing patients to a destination site here in Scottsdale, but also our businesses. That allows Scottsdale, our HonorHealth, to become a resource to the community. This is a program we put on for the Scottsdale Unified School District, bringing their teachers in for an intensive program, learning biosciences and helping to develop those biosciences leaders for the future and for job opportunities coming forward, because we're also a significant employer, and we see they're great jobs of great pay. So thank you, Mayor Lane. Thank you, the Cure Corridor, City of Scottsdale, and to our community leaders. Together we have increased the longevity and quality of life of patients. We've created knowledge that's not just academic, but that has actually changed practice and put new therapies out to be realized. We're helping to develop our biosciences economy and the community throughout the Phoenix area. A key development of TGen, TD2, Molecular Profiling Institute, IGC, imaging endpoints, and our universities. And that initial $4.5 million gift has led to more than $100 million back in just direct expenditures from our research institute into our community. So it has an economic impact as well. Thank you very much.